Okay.
Man,
Hello, my name is Michael Argren, and I'm a student from Nevada State College. Can you please state your name and your birth for me, please?
my name is Hannah Fleming. My birthday is 12/12/1912.
Okay, Hannah, let me just double check on your wristband again. Are you allergic to any medications or anything at all?
No.
Before you start, make sure you assess your patient's abdomen and bowel sounds. Make sure you check for any abnormalities and any in the size for the peg. Okay. So after that, you can go ahead and start to ask for your patient. Secretion. So make sure your patient's in a semi-palace position, and you make sure you put your bed up. Alright. First, you check for you make sure you check the tubing, make sure there's no occlusion or anything, and aspirate 100 ml or depends on your hospital policy. Okay. So this time I'm just gonna sanction 100 ml. Yeah, 100 ml here. So while I have this, what I can do is cover this up and check the pH for any acid or if the patient's stomach is too acidic. pH level is normal. So now after that, again, depends on your hospital policy, but you can return the gastric secretion, gastric fluids, and slowly. So what's in, and if you check everything's normal, you can go ahead and cover this. And now you can start the medication. So the doctor orders, make sure, before I start, I already checked my medication on MAR 3 times. Check, use the 6 rights. So the doctor ordered 2 tablets of ibuprofen. So when you're giving medications to through PEG, make sure that you grind the medication good and it's all powdered, so it's easier to dilute. Right. Make sure you check before you start. Alright, this is good. And make sure you take all the medication out. You can use this to make sure that you take everything. Okay, so once you're done with that, you can go ahead and mix this with water. And stir it, make sure there's not any precipitation or anything at all. Make sure it's all fluid. So while you're doing this, let it sit and cook for while you're checking your patient, okay? We're preparing your patient for the for the medication administration.
Go around right here. I'll be inserting here. And listening for those noises.
So I can just, before you start, make sure you flush your patient's 30 ml of water, still water, and make sure you hold this here to control the fluid.
Some of the stomach content. From the aspirations of that stomach content. Go off to the side. I'm going to check the pH of it. Sake of ATI.
30 ml of water, flush it. Make sure it's fluid and do it slowly.
So you gotta make sure you're not doing the correct thing. Put that back in there.
Okay. And now you can add your medication. Make sure you hold this again.
Now, what I'm going to do for the patient is
Medication.
I'm going to go ahead
Again, do it really slow.
and grab some tape. Some have like a
Right now you can add the and then flush again with 30 ml of water after the medication. How are you feeling?
I'm okay.
Right, Hannah, here we go.
Some hospitals have a nice, like,
Do you get a little flush? And once everything is good, cover this. Set this up here and make sure you assess your patient before.
well,
After you did administer the medication, and then that's it. And now you can start your therapy. So make sure that the tubing is clamped, and then you make sure you put the formula here, and whatever the other doctors order. Okay. Now you can start to prime your tube. So now, unclamp this and make sure it's upside down while you're priming it. And make sure it's not too full and it's just from this side on this area. Okay. It's not too full. It's really slow, but it's going. Here we go. So now you can stop when you reach this side. You can go ahead and put it right here, and you can attach this here. And you can clamp this for now before you start. And then here. So I'm just gonna hang this really quick and set this out. So it's gonna be 100 ml per hour. Okay, before you start, you can go ahead and connect. So make sure you have a towel or chucks on your patient's abdomen, just to make sure that you don't make any mass on your patient. Alright. So I can start this and make sure there's no air bubbles in the tubing to avoid any, so the patient won't be too gassy. Alright, looks good. Take the cover off and you can cover this and connect this here. Make sure you check your tubing for any occlusion or anything. You can, if you want, you can flush it just to be safe, 30 ml. But for now, since I just did that before I start this, I'm just gonna connect this here. And make sure you set this up here, wherever your patient's comfortable. And also make sure your patient's in semi-Fowler's position before you start anything. Okay? Alright, now you can start this. And clamp this. And follow it, make sure there's no air bubbles. Semi-Fowler's position, and now you can put the patient bed down to prevent fall. Alright, Mr. Eric, is there anything else I can do for you?
No, I'm okay. Thank you, sir.
Alright, just give me a call. Here's your call light, and let me know if you need anything, okay?
Alright.
Make sure you assess your patient's bowel sounds, and make sure you assess for any abnormalities, okay? And that's it. Thank you. Make sure you document all relevant information, the date, the time. Make sure you document the removal of the tube if it's intact, the amount and appearance if there's any bleeding or inflammation, and also the assessment of the patient. And make sure you put the name of the nurse and the date and the time. Thank you.